if hakuna NGO, community inaweza survive?
I think it will be hard for the community to survive,
Yes.
because we act as the linkage. Because we at the ground we are more connected to the community than the service providers.
This episode is brought to you by Converters Photographers. If you want good looking videos, sexy looking photos for your wedding, for your show, for your birthday, holla at them. The number is on the screen. Get in touch with them, and remember, when we get to 1,000 subscribers, we're gonna bring a sex worker on board so you can know how their work is and if they find pleasure in doing their business. But right about now, we are honored to have Mary Ann on the podcast. She works with the NGO, that's a non-governmental organization. So we're gonna talk about it. I'm Jay, your host, and this is the 60-second podcast. Enjoy. So, welcome so much on the podcast.
Thank you so much.
Yeah. Now let's begin from here. Where do you come from? Yeah.
Okay. Yeah. Good morning, everyone. My name is Mary Ann Nyambura-Dungo. I'm from Nyandarua County.
Yes.
Govt sub-county, working with a CBO by the name Vision Makers organization. It's a community-based organization.
Yeah.
So mostly we work on the ground with the community, trying to maybe help the community in issues about health, social protection, and maybe advocacy on policies and such.
So you work as an NGO.
As a CBO, community-based organization.
Community-based organization.
Yeah.
Yeah, and what impact do you bring in the community as in this way? Kwa community impact yenu, like if hakuna NGO, community inaweza survive?
I think it will be hard for the community to survive.
Yes.
Because we act as the linkage. Because we at the ground we are more connected to the community than the service providers or the decision makers like the leaders and what have you. But without us as the community-based organizations, it will be hard for the voices of the community to be heard. So we think we are part and parcel of the service deliverers in the community.
Okay.
Yes.
Okay.
In terms of maybe referrals, linkages, and also speaking on their behalf.
Yeah.
Yes.
And okay, CBO is community-based, so you work close to NGOs, right?
Yeah.
And what's the difference between NGOs, private sectors, and like government organization? Like, what's the difference?
A CBO is more connected to the community than the NGOs, because before you get to the NGO, now you have to pass through the CBOs.
Yeah.
The NGOs, or let's say the private sectors or the government itself, it can't come to know the issues in the community or at the ground level without maybe from the CBOs.
The CBOs.
Yes.
Okay.
So there's a kind of a difference between those, the NGOs and the CBOs. In most cases, you find that if a donor maybe comes to or is looking for somebody to use in implementing a kind of service or funding, let's say,
yes,
the donor will come through the NGO. Then the NGO will look for the CBOs at the ground level now to help them implement the programs.
Okay.
Yes.
And what do you focus more on in the community, like apart from what we see, like health? What other things do you do in the community?
Okay, we do awareness creation, or sensitization, let's say like for example, now we are at this time now we are talking more about SHA.
Yeah.
As the CBOs or the community-based organizations, we are encouraging our people or the community to register for SHA.
Yes.
So that they may be saving, maybe when it comes to health financing.
Yeah.
Because the community tends to listen to us more than the government, because as we understand what they are going through at the crowd. So that is what we do. Basically, we do awareness creation, sensitizing the community. Maybe there are issues with maybe kuna ugonjwa imetokea, like for now we had the mpox. Now we have that that responsibility of telling the community you have to take care of yourselves. When it was COVID-19, and now we were telling them to use their masks, sanitize, such things. So basically that's the work of the community-based organization.
And let's talk about a bit about NGO. So recently US ili back off that USAID imetolewa Kenya and other nations. How does that impact like Kenya as a nation?
Yeah, it really affected us so much because like the programs now that were funded by the US government mostly were for the let's say vulnerable people, like people living with HIV, TB. So they were so much affected. So us as the community-based organizations, we are speaking on behalf of the community that the government should intervene and maybe put aside a certain amount of money to cater for such things like treatment or care of the HIV and TB affected people. Also, we are sensitizing our community, our community members to think of maybe sustainability programs, like we are encouraging them to work on income generating activities so that they can sustain themselves. Even if there's no donor or maybe the government doesn't come in, they can still go on with their lives without anything being a problem to them.
Okay, and do you believe that Kenya is tunaboro, like tunasaidiwa sana? Because I read somewhere that 18% of healthcare service providers were being supported by the USAID. So it means Kenya donors ndo support sana, like about healthcare and all that.
Yeah, they support a certain percentage of the healthcare workers, of which we think that our country is capable of doing the same. Because I believe in Kenya we have money.
And why? So
we shouldn't really depend on donors or maybe help from other countries. What is really needed is just strategizing on how we shall deal with our own problems as a country.
And what do you think inazuia hiyo kukuwa implemented? Is it bad governance?
Well, that one is tricky. Because I think even the governance somehow affects. Because sometimes us as the CBO, we feel that we are not being listened to as by the government. Because if they listen to us, we have more knowledge on what is happening on the ground. So maybe we can help to some extent on how we can support our community members to maybe sustain themselves in times of need. Like for example, now that let's say the USAID has been pulled off, what can we do as a country now to survive even without the donors? So us as the CBOs, we are trying our best to help our community members. So if the government comes in, maybe helps those people, those vulnerable, those affected by HIV and TB, and if the government comes in, maybe they can support them in starting their income generating activities. So even if there's no other support from outside, those affected can still manage their issues without any help. Yes. So they just need empowerment, and the government or the people responsible can do that. I believe Kenya has the power to do so. We don't have to depend on donors.
That's wow. So another thing, let me pick your mind on a topic that I read also on the internet. It's just about the NGOs and the Red Cross. Is inanipotea. Okay. Like, okay, apart from the donors, like the big donors, where do the funds that comes to the community, like who donates apart from the big donors, like who contributes to the
okay, like for example, we have some NGOs in our country who we network with, or rather we collaborate with. We have Federation of Women Lawyers, that is FIDA Kenya. They help in capacity building our community members, or rather our CBOs, so that we can enlighten our people on their rights. We have Cascade. That one deals with nutrition. So they do capacity building. We help our community in empowering them on dietary diversification, how they could, they can be able to eat a balanced diet even without using a lot of money. We also collaborate with KENAM, that is Kenya NGOs Against Malaria. That one we do fight malaria. Empowering our community on how to prevent themselves from malaria and how to seek for care. We network with NEFAC. NEFAC is an NGO for people living with HIV and AIDS in Kenya. That one also supports our people. Sometimes they come in, capacity build the community members, and they get empowered. We also work with the network of TB champions. That one also works on the TB pandemic, and we are working on ending TB by 2030.
Ending TB?
Yes, which is very much possible. TB is curable. TB it's not that serious. If people get diagnosed at the right time, then they can be cured at the right time. So we empower the community on those grounds. That is how we work with other networks.
Okay, and can someone create his own NGO like
yourself? I think there's a procedure. Which now you go to the office of the social services. Now there you can get the full information.
Okay.
Yes.
And how do you ensure that the money that is donated or the funds reach the right community, like the right people who deserve the help?
In most cases, those donors or those people who come in to help the community, they don't come directly to the community. So they have to go through the government. So the government will identify now through the CBOs the people who are supposed to be helped by that kind of grant or donor or funding. So by that, the money will directly go to the people who are supposed to benefit from it.
Okay, so the government is involved even in the NGOs, non-governmental.
Yeah, you can't implement any program without the government. Yes.
Oh. And does corruption affect your work in any way?
To some extent it does.
How?
Like for example, us as a CBO vision makers,
yes.
There was a time we had a proposal on TB program.
Yes.
And even though we us as a CBO we had not we were not really known for ground, maybe by the county government, but the proposal didn't go through.
Yes.
And the person who won the tender now was somebody outside our county, whereas we are in the county, knowing the problems of our community members, but now someone somewhere was given that opportunity to come and implement the program in our county. So that one we felt it was not good.
Yeah.
And we would really ask the government to consider the CBOs at the crowd, not only in Nyandarua County, but also in other counties, because those people are more conversant with the problems in the crowd, on the ground, so they can implement the programs better than anyone from outside the county.
Yeah, that's true.
Yes.
Yeah, and how can someone, if someone has an idea, how do they pitch to the NGOs? Like, how can you reach to them?
I think most of them have their websites.
Yes.
So reaching to them it's not that hard. You just go to their websites, or maybe I think they have a way.
Yeah,
they have a way of connecting with them.
Okay. And what are the problems that we face, like as a nation at the moment, in the healthcare service? Like, what are the three major things that you think issue we face, like as a nation at the moment?
As a nation?
Yeah.
One, when yesterday we were somewhere, we were talking about SHA.
Yeah.
Nowadays, when you go to a health facility,
yes,
if you've not registered with SHA, then you can't be given the service. Registering with SHA sometimes is becoming then another problem, because you find that you register someone, but then the money they are told to pay monthly is more even than what they can get. So we were trying to ask ourselves, what is this criteria that is being used to maybe know how much someone is supposed to pay?
Yes.
For example, you get an old person, an elderly person, depending on what the children will support him or her with. Then when you register her or him, you find that monthly he or she is required to pay a premium of 1,050, which is very too much for such a person.
Yeah.
So that one is problem number one.
Yes.
The second one, in most of our public health facilities, you find that when you go looking for services, your services are provided, yes, but now getting the drugs or the medicine from the facilities another big problem. So wanakuandikia tu, daktari amekuona, prescribed the drugs for you, but now you have to go back to your pocket, chemist. Now to the chemist again to buy the drugs.
Yeah.
So that's another problem again. The other issue is, in our communities, we have this problem of men seeking health services.
Yeah.
In most cases unapata mzee ni mgonjwa, lakini kwenda hospitali inakuwa ni shida. they wait until the last minute.
Yeah.
So let's assume it's a TB case. Mzee ni mgonjwa, hataki kwenda kwa hospitali. And we have let me say 2 types of TB. Kuna yenye this one ina affect the respiratory system, tunaitanga pulmonary TB.
Yes.
Hiyo contracting other people, it's very easy.
Unaambukizana?
Sana. Okay. So if a man gets sick with TB, hiyo ya pulmonary, and now the health seeking behavior is very utapata sasa ameambukiza familia mzima. So that one is another challenge. So we are encouraging our people, and mostly men, when it comes to you are sick, please seek for medical attention as soon as possible, so that you can also keep your family safe.
Yeah.
So I think those are the major challenges.
Hizo ndio challenges kubwa kwa ground. And HIV iko na impact yote kwa community. Kwanza now that ARVs nasikia like zinakuwa ni ngumu kupata.
There was a time zilikuwa ngumu kupata, but for now ziko kwa hospitali. And the ARVs are given freely. Testing is free. So I think hiyo tu shida ya kwenda hospitali. You see many people in our community fear being tested.
Yeah.
I don't know why, but we also encourage them. It's good when you know your status, because now you have to make the right decision on how you live.
Treat them.
Yeah. If you test negative, you know how sasa nitaishi namna hii. If you test positive, now you see how you will do with the life again. But now ukikaa kama hujajua status yako, the more things are getting worse.
Yeah. And so
again on HIV, I think the prevalence rate here in Nyandarua and mostly in Kinangop is within the youths or the adolescents.
Oh.
They are more affected. I don't know why, but we are encouraging our people just to abstain, and if you can't, please use protection.
There are free protections.
Kabisa. We distribute them in our office. We give people, and we have points where we go and put for people to correct from there. In public offices like hapo kwa DC, hapo kwa registration, hapo. So people can pick from there. Even in public hospitals, ziko hapo na ni free.
Watu watumie mipira.
So people don't have a reason for maybe getting infected.
Yeah.
Yes.
So let's go back in the beginning when you started the CBO. Okay, what was the idea? Yeah.
Okay, our CBO Vision Makers. We started it on 2016.
Yes.
Registered with the social services on 2017. And what drove us to that is the problems that were in the community. There were so many cases of TB.
Yes.
And so we were like, what shall we do now to help our community? We also found that we had so many cases of orphaned and vulnerable children who were as a result of the HIV pandemic.
Yes.
So by that we decided now we have to come together as some of the community members, so that now we can start looking for support, maybe from other sources, from the government, from NGOs, that we can support our people, maybe educate them on how to prevent from TB, HIV, and how to seek for care for the same. Also, we had the idea of supporting the vulnerable children, the orphans, in education, and also in some basic things at the household level.
Yeah, and how has it been so far?
It has been hard because as a CBO, we've never had any funding from anybody. Though we had been partnering with some organizations like Feeder Kenya,
yes,
where we have been referring some cases of gender-based violence, and they have really helped us. So we have some success stories that we can give out of collaborating with FIDA Kenya. We have never got any funding, but us from our pockets as the CBO members. Now we really, or we try to help our community members, now the needy ones, by maybe linking them with, let's say the bursaries. This one from the CDF. We have another one from the president, tunaita presidential secondary school bursary. We have some few cases that have benefited from that, and we also refer them or link them with the Equity Bank for Wings to Fly. We have several children we have helped in that line. So that is what we do.
So it's hard without the funding.
It's really hard. It's hard, but we are still working. And we are, in case we find an opportunity, we do proposals, even if hakuna hata moja imeenda through.
Hazifiki place zinafaa kuenda?
Inafika, but sometimes unapata the requirements maybe we haven't met.
Oh, they are looking on the data.
Like enye tuliandika ya mwisho. The issue was that we did the audit report ikiwa combined. They were expecting we do it yearly. Now we did for 2 years and we combined it. Now that was the only problem, that we didn't get the proposal. Yes, we didn't get the funding.
So utambia nini wale mnawaomba fundings like at this moment?
You see, this work now that we do as the community-based organizations, it's basically voluntary, and we do it to help our communities. Maybe we bring them from some level. Now we help them to sustain themselves, or maybe to we try to change their lifestyles, or maybe uplift them from a certain level now. So my request as a member of the CBO, I would request the government to support us in any way they can. And also the donors, because I know they are there. Maybe they are looking for people to implement with. As a CBO, we are ready to do the work. We know the problems of our people in the community, and we are really willing to help them tirelessly and voluntarily, because we were called to do that. So my request is that if the donors can just help the CBOs and trust them that they can deliver what they are looking forward for, we can change the lives of so many people in the community.
And so while we wrap up, so how do people get in touch with their services? Like, how do people donate?
We have a we have a channel. We have an account with Equity Bank. We also have a till number. So anybody willing to help. We don't. We are working on our website right now, but we can donate through the Equity account on the PayBill.
Equity is partnering with you.
They are part of us.
Oh, okay. So what's the till number? Just in case someone wants to donate.
I don't have it offhand.
Okay. Number iko kwa screen, guys. Mnafaa donate bana. So as we wind up. anything else tumesahau kukuuliza?
Yes.
Yeah.
I have a request
Yes.
to our county government.
Yeah.
I think we are so many CBOs in our county
Yes.
working in different thematic areas.
Yeah.
So I would request the county government that they engage us in especially in the budget making process.
Yeah.
Because we know what what our people requires.
Yeah.
So if they engage our CBOs in decision making regarding our county, regarding our people, I think we can deliver more than maybe they have been doing there before.
Okay.
Yes.
So government, mnasikia, mnafaa mchipin bana. And how many beneficiaries are on your CBO right now?
Right now I think we have 13 students.
Yes.
Benefiting from different areas. We have those that are benefiting from Equity Bank Wings to Fly.
Yes.
We have those that are benefiting from Presidential Secondary School Bursary, and we have others benefiting from the NGCDF. Also, we have beneficiaries, those people living with HIV.
Yes.
They are there. We are monitoring how they are progressing. We do home visits.
Yes.
Check on drugs. Check on how they are feeding, and also we help them manage stress in case there is. So we have others. Those are TB clients.
Yes.
We also follow them up, and we provide psychosocial support.
Okay.
Yes. So like now we have the patients or the clients. We have like 50
clients.
Yes, and the students we have 13.
Yes.
All that we do from our pockets. Even though we have some friends, some well wishers,
Yes.
they come in and maybe support here and there.
Yeah, but mostly you do it by
Mostly,
yourself.
yeah, from us now.
Okay.
Yes.
That's a wrap. Sindio?
So even to well wishers,
Yeah.
I know they are there.
Yeah.
Those people looking for maybe somewhere to chip in, opportunity is here. We
Yeah.
have people who are needy in our communities, looking for someone to help them. So my request is, if you are there and they are willing to help someone or to change a life,
Yes.
tafadhali, the time is now. Our office is located in Engineer Town,
Yes.
Kahuru Building, room number 11. So you are all welcome tufanye hii kazi pamoja,
Yeah.
tusaidia our community, and God will bless us all. Thank you so much.
Amen. Amen. Okay, thank you so much for coming on the podcast. Yeah, it's an honor to have you here.
Thank you so much.
Yeah, and I hope mmelearn bana, mmejifunza. Na subscribe kwa channel. Waambie maybe watakusikia wewe. Waambie subscribe kwa channel.
Well, yeah.
Waambie
Because
subscribe.
now we get to know more about what is happening on the crowd. So subscribe, get more knowledge, be informed, and we grow together.
Yeah, so
Thank you so much.
it's just this 60-second podcast, and remember, we live a minute, guys. Peace.